Doctor on Call, we believe that healthcare is universal. Everyone should have access to good medical advice regardless of their locations.
So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At Doctor On Call, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this will actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online, so the patient can get treated to a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology to create better patient experience and continuity of care. We design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via Doctor On Call platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, once just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy.
Hi, good afternoon everyone. Thank you for joining us for another session of Q&A with a specialist. Today I'm very happy to introduce our very special guest, Dr. Chong Kuoren of Thomson Medical Center Fertility here in Puchong. We're recording live today from his office, and thank you Dr. Chong for joining us.
Thank you for inviting me.
Okay, Dr. Chong is a obstetrician and gynecologist. right? And he has a special subspecialty in fertility and what do you call this? Fertility and reproductive medicine. Is that right?
Yes, correct.
Dr. Chong. And today we are talking to him about a very interesting topic called cryopreservation, or in simple terms, freezing your eggs. Okay, Dr. Chong, I would like to know this cryopreservation, right? What is it actually about? Who are the people who need this?
Okay. Now, cryopreservation basically means freezing your eggs for ladies or freezing the sperms for guys. Okay, so you're freezing them earlier when you're younger, when the eggs are better quality, sperms are better quality, so that you can use them later on, 5 years later, 10 years later, when you're a bit older. Okay, maybe you're 40 something, but you still have eggs frozen at when you're 30 years old.
So it helps preserve sort of life
Yes, correct.
for couples. So, ladies and gentlemen, if any of you have friends or family who you think would benefit from understanding more about cryopreservation, we're also streaming live on Facebook. Please do share with those people who you think this would benefit. Yeah, and without further ado, Dr. Chong, shall we jump into your presentation today?
Yeah, of course.
Sure. All right, sure. Let's go. There you go.
Okay, so thank you for joining us. I know it's middle of the week, so everybody is busy at work. Okay, so the slides, okay, and we're going to cover about 20 slides. We should take about 15 to 20 minutes. Okay, the topic for today will be fertility preservation with cryopreservation. Okay, I'm Dr. K.R. Chong. I'm a fertility doctor. Okay. Okay, so a bit about background. I'm working at TMC Fertility. This is the Puchong branch. Our group, we have 6 branches throughout Malaysia. Okay, we have in the north, we have a branch in Penang, Ipoh. In the central region, we have Puchong, Kepong, as well as Thomson Hospital. And down in the south, we have a branch in JB. Okay, along the past few years, we have picked up some awards for our services in fertility. Okay, now, what is cryopreservation? Cryopreservation simply means a process that preserves the cells, tissues, or any other biological components by bringing down the samples to a very low temperature. Okay, so what tissues can be cryopreserved? Okay, most of the time we preserve or we freeze embryos. Embryos are the byproduct when we put the sperm into the eggs. After we put the embryos back into the womb, the embryos will grow into a baby in the future. Okay, second one is, of course, the eggs or the sperms, which we are talking about today. The third one will be we can freeze ovarian tissues. Okay, and finally, of course, the sperms are also, we can freeze them as well. Okay, now most of the freezing technology comes from research done in IVF. Okay, IVF research has been around for 50, 60 years. And the first IVF baby was born almost 40 years ago in 1978. Okay, over the past 40 years, we had a lot of new advances, including egg freezing, embryo freezing. So the first human birth from the use of frozen sperm was reported way back in the 50s, but it took about 30 years to get a live birth from egg freezing, from the frozen embryo as well as the eggs.
Dr. Chong, maybe you could give us a bit of insight. What happened? Why did it take so long? Or what are the challenges actually, when doing this procedure?
Good question. This is why. So the challenges with freezing the embryos and the cells is the nature of water. Okay, human body, most of the cells, 70% is made out of water. So what happened? I mean, in school we learned that when we freeze water, it actually expands because of the crystal formations. So this damages the cells. Okay, and the cells may die because of the cell damage.
And a lot of these cells are not even visible by the human eye. You actually would have to use quite powerful microscopes to view them, right?
Yep.
So they're very delicate. How do you manage such a delicate, is this a single cell, right? It's not even a tissue,
Correct.
right?
So now the scientists who freeze the eggs are the embryologists. Okay, I'm just a doctor. So embryologists also play a very important part in egg freezing. They are the scientists that you don't see them because they are hidden in the laboratory. Okay, but in a fertility center, they pick up 50% of the work. Okay, so they're very important. So how do we keep the cells from dying off? Okay, so for a long time, over the 30 years, our approach has been to freeze the cells very slowly. Okay, what we call slow freezing. Okay, the initial survival rates are pretty poor. Only 10% of the eggs or embryos will survive. Then over the past 30, 40 years, we managed to push it to 80%. Still not ideal, but that's the maximum limit of slow freezing. In slow freezing, we freeze them sequentially over 30 minutes to minus 190 degrees Celsius. Of course, we have to add some biochemicals called cryoprotectants to even protect the embryos or the eggs so that they won't damage when freezing.
So this 10 to 80%, is that a normal variance today, or do we have quite a consistent rate already?
Now slow freezing is no longer done. This is the old technology, the old method. So now what we do is we use vitrification or flash freezing. Okay, in 2005, a Japanese group, they published a paper whereby instead of slowly freezing over 30 minutes, they instantaneously freeze the cells to 190 degrees.
And do we still need to use any cryopreservatives?
Yes, this is possible only with even advanced cryoprotectants.
Right.
Without this, then the embryo will suffer the same damage.
So would it be considered like a food additive, so to speak, to preserve and maintain the cellular structure and its function?
Yes.
By adding these.
So examples of cryoprotectants, will be like sucrose and some biochemicals called DMFC. I'm not very sure. You have to ask the scientist. So with the improved cryoprotectants, the survival rates of frozen eggs and embryos is up to 95%.
That's quite a significant jump from the initial 10%
Yes.
that we had 40, 50 years ago, yeah?
Yes. So initially 10% survival means if we freeze 10 embryos and we unfreeze them, 9 of them will not survive. So now if we freeze 20 and we unfreeze, 19 of the embryos will survive.
Amazing, amazing.
Okay, so yes, let's move on. Now, why do we want to freeze the eggs, embryos, or sperms? Okay, so we have two basic categories. Of course, in the fertility center, freezing eggs, embryos, we do it every day. Okay, but for the purpose of our talk, it's for the fertility preservations. So fertility preservation, two big categories. Number one, people who have cancer. Okay? Unfortunately, young people also get cancer. Children, teens, for example, leukemia, thyroid cancer, bone cancer.
Dr. Chong, perhaps I could take a step back,
Yes.
right? And just focus on this word fertility.
Yeah.
Now, we all know fertility is, pertaining to your reproductive capability of the body and all
Right.
that. But, when a patient or a couple walks into your office, what does fertility really mean to them?
Okay. Fertility means the ability to get pregnant naturally within a certain time frame. Okay, so for us in general, couples after they get married, after 3 months, about 40% or 50% of couples, they would have gotten pregnant by themselves. Okay. After 6 months, about 60, 70% already get pregnant, don't need to see any doctor. And at the end of 1 year, about 90, 85% would have already gotten pregnant. So if somebody has been trying hard for 2 years, 3 years, and still not getting anywhere, still no good news, then they may have a problem with fertility.
And when they come up to you for consultation, most of them have already tried different methods.
Of course. So of course, modern society, everybody has been on Google, everybody has asked their friends, they have asked their relatives. So most of the people now we see, they come with a lot of knowledge and a lot of research done prior to coming over.
Right. And ladies and gentlemen, with all the information that we have today, it's okay for you to go and find out with Dr. Google, but please, when you do need a specialist consultation or more advanced, advice, please do seek, people like Dr. Chong, okay, and the various others, doctors and specialists that we have on our platform, Doctor on Call. Do educate yourself, but please follow up with a specialist, with a trained professional if you need, proper advice. Okay, so there's a slight PSA there, Dr. Chong. Yeah. Okay.
So picking up the PSA, a lot of information on Dr. Google. Some of them are helpful, but some of them are not very helpful. So it can be very confusing. I wouldn't call them fake news, but sometimes you really need a professional eye to tell you directly whether certain products work or certain treatment works. What we need to differentiate is when you Google a lot of information, they are actually produced by people who want to sell supplements, and they promote their own agenda. So that's why you need to be very careful as well.
Absolutely, Dr. Chong. That's very correct.
Okay, so back to our thing, fertility preservation. Okay, now if you're talking about cancer treatment, how cancer treatment, apart from doing surgery to remove the affected part, the follow-up treatment, we need chemotherapy or radiotherapy. So chemotherapy and radiotherapy, how they work is they try to kill off the cancer cells by giving chemicals, okay, or even radiation wave to kill the area around the affected part so that the cancer cells will die off. Unfortunately, the sperm and the eggs are also affected by these treatments. So most of the time, cancer survivors, they are free of the cancer, but they find that they are not able to have children later on.
So, Dr. Chung, that means that somebody who is potentially receiving a treatment that is potentially going to harm other cells in the body through the usage of, chemotherapy or radiation, have now a chance to preserve life,
yes,
even beyond their treatment cycles,
yes,
right? And come back to it later when they are healthier and start, planning for their families in future, right?
Exactly.
That is amazing. That is amazing. So, any of you who have this similar situation and you're worried about, the age, so to speak, of your eggs or the vitality of your sperm in future,
yes,
right? This may be a treatment option or like even a therapy option that for you all to consider. Yeah, right.
So previously, when we talk about cancer treatment, we of course we don't think about having children because the first thing on our mind is of course getting ourselves cured, starting treatment. So nowadays we work with our oncologists, with the cancer specialists. Sometimes we need to remind them that, especially younger patients, okay, if they are in the teens or early 20s, of course they won't be thinking about starting a children, but it's necessary to tell them, look, you may the treatment is now the modern treatment, you may be able to survive this, and later on when you're in 30s, you may want to start a family. So this is the treatment available now.
Excellent.
Okay, so the next category, of course, would be what we call the social. Sorry, let me just go back to it. Okay, social issues. Okay, for fertility preservation. As we know, our society is getting more advanced. Okay, and our workforce, 50% are women. Okay, so in all jobs, we need to work hard at a certain job for a long time before you can advance in your career. And so unfortunately, you have no time for social, no time to get married, okay, and having children will go down in the list of priorities.
Right. So there's been a huge shift in social behaviors, I suppose, over the last 30, 40 years. And a lot of it has got to do with development, advancement in careers, women also taking a lot more leadership positions in, corporates and businesses today. So this offers them a chance to actually focus on what they're doing at that time and come back to it when they are probably financially or even mentally more prepared.
Of course.
Yes, that is amazing for all working women and professionals, even for men.
Oh yeah, of course.
Okay, yes. Okay.
Okay. So about 6 years ago, Facebook and Apple, they actually announced that they would offer to freeze the eggs for their female employees. So this actually generated a lot of publicity about egg freezing, okay, especially overseas. Not so much in Malaysia because we are still a bit conservative. So this is exactly what we're talking about. So in the technology environment, okay, they have to work very hard. Okay, no social life. Okay, they're almost married to their job, and So some ladies, because they want to start a family, then they decide to quit so that they can focus on their families.
That's good to know.
Okay, so how do we freeze the eggs? Okay, because this is one we are talking about. Okay, so two ways. Okay, the first way is the lady has to undergo an egg freezing cycle or egg freezing process. The second way is to freeze the ovarian tissue. Okay, so this is an outline of a full IVF treatment cycle. Okay, the egg freezing is a small part of it. Okay, so I'll just quickly go through. In a full IVF cycle, for about 10 days after, during the first or second day of the menses, the lady will need some injections. Okay, the purpose of the injections is to get about 10 to 15 eggs growing. Okay, on the day 12 of the cycle, we will collect the eggs. Okay, this is done under anesthesia. Okay, and for IVF, that's where the sperm comes in. We will mix the sperm and the eggs together, and the embryo will fertilize. We will observe to 5 days, and we pick the best quality embryo and transfer it back into the womb.
Right. So we need to coordinate this with the women's ovulation cycle, or is that something that you can also induce?
Usually we start on the second day of the menstrual cycle. So, but if the lady has irregular cycles, there are tablets that we can give, to sort of sort everything out.
And I suppose under anesthesia, the lady would not feel any pain.
Yes.
Or discomfort.
Yes.
Yeah. And how about the men? The men needs to also contribute in this.
This is for a normal IVF cycle.
Okay.
If you're talking about egg freezing, you don't need the men's.
Right.
Or maybe there's no Mr. Right yet.
Right. Understood. And then later you would harvest this fertilized
the mature eggs.
The mature egg.
Yes.
Okay. And then go into cryopreservation if necessary,
That's right.
or decide to inseminate it with some semen.
Okay. Now, if the lady is married already and the husband is already there, okay, then we can get the sperm in straight away and freeze the embryo. Okay. So we will choose the best ones and we freeze. If there's no Mr. Right, it's just her alone, then we take out the eggs and we freeze it on the same day itself.
Right. Understood.
So in the egg freezing process, this is more simplified. Okay, we just get the injections, collect the eggs, then we freeze the eggs straight away. Okay, don't need the husband's sperms or don't need the male sperms. So the egg freezing cycle is pretty straightforward. Okay, of course, there's a little bit of injections, around usually 10 days of injections. The egg collection will be done under anesthesia, around 20 minutes. Yeah. So this is suitable for things like social aid banking, as well as ladies with cancer. Okay. Now, we are talking about cancer diagnosis. We don't want to waste a lot of time, okay, because they want to start their operation and treatment for cancer. So if you are talking about somebody with cancer, if they can spare that 10 days, we can start the injections anytime. It doesn't matter which cycle, during the bleeding and all that, we can start straight away.
Are there any specific type of cancers whereby cryopreservation is part of the treatment protocol?
At this time being, no.
And what are the common ones that you would advise cryopreservation for?
Ladies who are younger, teen, 20s, early 30s, whereby they still have not started their family.
And is it limited to cancers of the reproductive system only, or any type of cancers that you would recommend this to happen?
Brain cancer, tumors, thyroid cancer, leukemia. Okay, those are very common ones.
And even more so if they needed to do some kind of therapy, which involves chemo or radiation.
Correct.
Is that right?
Correct.
Okay.
Okay. Now, so another treatment we have to freeze or cryopreserve. Okay. Sorry. Okay, just go back. So once we have frozen the eggs, okay, let's say she has recovered from cancer 5 years, no cancer recurrence, then we can treat the lady as cancer-free. Or those who do a social freezing, as in they haven't found Mr. Right, 5 years down the line when they have met the ideal candidate to get married with, they will try to conceive naturally first. Okay, if they can't conceive naturally, then we have the backup eggs which you can use. Okay, so we will unfreeze the eggs, we will fertilize together with the partner's sperms. Okay, then we will transfer the embryo back into the womb.
Okay, so for all you ladies who haven't found Mr. Right, this is potentially a good option, so that you may focus on other things in life according to your situation and come back to having a child later. Yeah, so please do share this with any of your friends who you think may be in a similar situation. Okay.
Sorry about that. I think there's... Okay, so the second way to freeze the eggs is by ovarian tissue freezing. Now this, we don't do it very often, not so common, okay? But this is if the cancer diagnosis was diagnosed very late and we do not have much time to go through 10 days or 12 days of injection. Okay, or this is suitable for younger group of ladies, for example, before puberty, when they're 9 years old, 10 years old, or teenagers where injections or the egg collection is not suitable, then we will take the ovary itself and freeze the tissues. Okay, so how is this done? Okay, keyhole surgery or laparoscopic surgery will be performed. This takes about 30 minutes, 45 minutes. Okay, number one, we can either remove one ovary. We don't take out both, we keep one inside. Otherwise, the lady will become menopause straight away. So we take out either one ovary, or if we do not want to take out the ovary, we just take a small part of the surface of the ovaries. The surface is where all the eggs are stored. Okay, so after then we need to process the ovaries and we freeze them. Okay. Then 5 years down the line, after she's recovered fully from the cancer, we'll do a second surgery where we unfreeze the tissue and attach it back to the ovaries.
Right. So very, very advanced stuff. I suppose laparoscopic methods have really helped advance cryopreservation,
yes,
and the collection of sampling and things like that. Now, ladies and gentlemen who are viewing at home, first of all, I hope you're all having a good Bulan Ramadan, with your fast, okay? And for those of you who are not, please do make yourself comfortable. And we're open for questions, yeah? So any of you who would like to ask questions regarding cryopreservation, please do type them out in the chat box, okay? And of course, if do share this very interesting talk with Dr. Chong from TMC Fertility Puchong with any of your friends or family who may benefit from this topic, yeah?
Okay, now this is also another question that I always get. How many eggs should I freeze? Now, we know that each egg does not mean one baby. So if you freeze 15 eggs, you won't get 15 babies. Okay, because this one depends on the age when the egg freezing is done. Okay, unfortunately, because of the biological clock, as the woman's age increase, the quality of the eggs also drop. Okay, and also the miscarriage rates are a bit higher. Yeah. So from statistics-wise, if the lady is less than 35 years old, on average, we will be able to get about 15 to 17 eggs. And based on the past studies where they do a lot of egg freezing and unfreezing, we need 7 eggs to get 1 healthy pregnancy. So if after 35 to 37, on the average number of eggs collected also drops slightly, and the number of eggs needed for 1 healthy pregnancy also increases. Okay, so if you get 14 eggs, we may be able to get 1 or maybe 2 healthy pregnancies. So if we go up in age, then we see that the more eggs are needed for 1 healthy pregnancy, because miscarriage also goes up. So she may get pregnant, but it may end up with a miscarriage.
So, Dr. Chong, my question would be, as a lady grows older, does that mean that they have to go through multiple collection cycles in order to increase their chances of getting a healthy pregnancy?
Yes, exactly.
And how would that work? We have 2 main techniques, right?
Yes.
One which is a complete removal of the ovary, and one which is a partial removal of the surface of the ovary. So I suppose we call this the harvesting.
That's right.
Right? So during harvesting, how would this work out for somebody who's above 41?
Okay. Okay, above 41 in general, we can freeze the eggs, but the egg quality will not be very good. So if practical wise, to ensure that we really end up with a healthy pregnancy, she may have to do multiple cycles to get as many eggs as possible. One round will not be enough.
Right.
So egg freezing, as well as in normal IVF treatment cycle, the older the age group, and then the success rate also drops. That's why in normal IVF, some ladies will need to do 2 or 3 rounds of IVF because of the same reasons. And the egg quality drops, the egg quantity we manage to get also drops.
So I suppose a complete ovarian harvesting would not be possible for in this age group. We would have to do multiple surface extractions.
Correct.
Yes. Okay. So ladies, if you are getting slightly older, you may have to do a couple of treatments before we actually can get enough eggs to ensure a healthy pregnancy in future when you find Mr. Right, or once you have settled down and really for a child.
Exactly. Okay, so let's just take a break and see this on the real life and real life scenario. Okay, so this Miss Lin, Lin Shilin, she's a famous Taiwanese actress. Okay, she got married about 2 years back when she was 44 years old to a Japanese rock star. Right. So this report came out saying that she has undergone an advanced form of IVF whereby the probability of conceiving twins is high. Okay, we know this is not true. Okay, that's why I put the cross over the high.
So this is fake news.
Well, it's a sort of news. It's not exactly correct. So a lot of medical related news, we have to take it a bit of pinch of salt.
Once again, ladies and gentlemen, be careful when you consult with Dr. Google. We have professionals like Dr. Chong who are experts at these kind of questions. Please do make a booking with them if you need a consultation. Yeah, Dr. Chong, please tell us more about this debunking this headline.
Okay. Now, so if you read further on this article, okay, they mentioned that the journalist reported somehow they spied and they managed to get the information that she froze her eggs back in 2014. At that time, she was already 40 years old. Okay? So they managed to get 9 eggs, okay, and 7 were healthy enough to be frozen. Okay? Now the doctors that did the surgery estimated that she has a 20% chance of conceiving successfully. So it's only 20% chance. Okay, not twins. Okay, not very high chance. It's only 20%.
Understood.
Okay, so not that great. Okay, because she's already 40 years old.
So sounds like a very sensationalist headline.
Yeah.
But really, when we read into it, the numbers are pretty much are these average numbers compared to other treatment centers?
In Taiwan, the technology of IVF is actually pretty good. Okay, because a lot of their doctors they train in US, so they are bringing in the latest techniques already.
Right.
Okay, so, but we can't fight with age. Age is our biggest limiting factor. Okay, so going back to the same thing. Yeah, so if she has 40, if she managed to freeze 7, okay, by right she should have 50% chance of getting it. So probably the doctor is a bit pessimistic, so if you have 5 eggs, okay, you need 16 eggs. That means it's only between 20 to 15%.
Understood.
So what all these celebrities they should have done is to freeze them even earlier, when she's 35, 32 years old.
So I guess from this slide, we can conclude that the earlier you freeze the eggs, the much higher your chances of success, right?
Yes.
So ladies, do think about this process when you're younger, okay? And it's something that, as you mentioned, today's lifestyle, the social factors, I think they're very, very important to consider such therapies, to preserve life.
Okay, so we are almost ending. Okay, what about men and sperm freezing? Okay, the specimen collection is relatively quite straightforward. Okay? We just need to give a container, and the male part, the guys just release a sample. And usually, if the sperm is good, we are able to freeze 3 or 4 separate, enough for 3 or 4 rounds of treatment.
So it sounds like a very straightforward job for the men.
Yes.
Okay, but I'm sure it's not that straightforward for the patient. Yeah, maybe you could share a little bit about what the men go through when it comes to preserving their life and with these techniques and things like that. What are the common things that they're worried about? Or
now the problems we see would usually be couples. Okay, so they have tried for a couple of years, and two category of men, two types of men. It's a bit of about men psychology as well. So number one, a lot of men think their sperms are healthy even when they reach 90 years old, okay, which is not true. Male also undergoes aging, so the biological clock also happens in males. So usually after 30 years old, in fact, we find that about 40% of couples who do not get pregnant, the sperms have an issue. So up to 40%. So it's not always the female, it's sometimes also the male side.
yeah, and for the audience benefit, men and women, ovaries and sperm
Yes.
are produced in very different ways.
Correct.
Ovaries actually come with you when you're born, and there's a fixed number of ovaries and eggs that you have, and these are constantly being channeled out through your ovulation cycle once you hit puberty.
Exactly.
Right. So by the time you hit 40, you're actually carrying 40-year-old eggs.
Correct.
That have gone through maybe like another 30 years of ovulatory cycle.
Correct.
However, for the men, I hate to put it this way, but there's always a fresh supply, right?
Yes.
However, even though fresh supply is constantly being produced over years, the number of genetic, I'm not sure whether it's genetic or maybe even physical deformity increases. Yeah, because it's like a factory constantly producing.
Correct.
Over time, it's bound to not be so fresh anymore.
Correct.
Yeah.
So for the guys, fortunately, every 60 to 80 days, there are new batches of sperms coming out. Okay? So if you check a 80-year-old male, okay, there will be some sperms, but the sperms are from an 80-year-old factory. The testis is 80-year-old. So a lot of big percentage will be abnormal as well. So imagine if you collect it from an 80-year-old factory, and the quality will not be that great. And of course, over the years, we'll pick up things like medical illnesses, diabetes, high blood pressure. We have bad habits. We smoke, we drink alcohol. We're exposed to environmental toxins. All of this will play a part in affecting the quality of the sperms as well.
Understood. Yeah.
Yep. So the take-home message is for the sperm as well as the eggs. If you're thinking about freezing, the younger the better. When your body is fit and healthy, when the sperm and eggs are at the youngest.
Right. Okay. Perhaps we have a question coming through, Dr. Chong. Maybe we can get to some of these these questions from the audience. And for the rest of you, please do type in your queries or questions so that we can get around to them. So we have one over here. Okay. Through ovarian tissue preservation, does that mean the tissue did not age and the tissue will reproduce the egg and quality of the egg as current age of the freezing age, right? That means, I think what our audience is trying to say, if we remove a tissue, you're actually taking a snapshot of of that period of time in the woman's health, right?
Exactly. So ovarian tissue preservation as well as egg freezing. Let's say the procedure was done when the lady is 29 years old. We freeze, we are hibernating it. So let's say 5 years later when the lady is 37 or 35 years old, okay, and when we unfreeze them, the egg quality is the same and the ovarian tissue is maintained.
Right. And I know we've come across, I know we said that the younger the better, but is there really an ideal age?
Well, ideal age, preferably less than 35. Okay? Even better if it's less than 30 years old.
And is it something that women can do as soon as they hit puberty?
Okay, now for the egg collection cycle, it's a bit difficult because monitoring the eggs growth, we need to do something called an internal scan. Okay, so it's not suitable for ladies who have not, have physical intimacy before. Okay, so for those who have not had physical intimacy, then maybe we need to do an ovarian preservation through a laparoscopic surgery.
Understood. Yes. Okay.
So those are the technical problems.
So There you go. I hope that answered your question. And if you do need any further advice or consultation, do scan the QR code on your screens over here. Nowadays with the pandemic, everyone's already used to scanning QR codes and things like that. So it's very straightforward. Everyone just get your phone out. You scan the QR code, okay, and that would lead to directly to Dr. Chong's profile, okay, and you can go ahead and either make a booking with him in person here in Thompson Hospital, Thompson Fertility, or even a video consult if you had already a consult with Dr. Chong in person before, yeah? So go ahead, scan that link and make some bookings if you have more advanced questions. All right, next we have a question from a man. All right, Mr. Luke. Men who are above the age of 39 have shown increasing rates of pregnancy loss, as well as birth defects, infertility, autism, and schizophrenia. Is that true? Is that true, Dr. Chong? As men age,
Yes.
they also contribute to increased rates of these kind of problems. Yeah?
So unfortunately, yes. The answer is yes. Schizophrenia, I'm not very sure, but all the rest, infertility, miscarriage, autism, those are also related to the male age. Yeah? So males are not impervious to aging. They are also subjected to the ravages of time. So I always tell my patients, for a healthy embryo, a healthy baby, the eggs and the sperms need to be healthy. Okay, so the importance is 50-50. Okay, so no point having a young good eggs, but the sperms are bad. Okay, so sperms, especially if you're hit 30s, lifestyle plays a choice. Okay, if you don't have enough rest, you don't take care of yourself, you have diabetes, you have high cholesterol, you smoke cigarettes, okay, you take a lot of alcohol, those definitely will have an effect on the quality of the sperm being produced.
Okay, so Dr. Chong, we hear a few things that are consistently bad. Smoking,
yes,
consuming too much of alcohol.
Yes.
What else really deteriorates the health of the eggs and also the sperm for people who are keen to cryopreserve? Well, what are the other things that they should avoid?
Okay, in general, the best thing is to have a healthy lifestyle. Sleep early, as you mentioned before, do a bit of exercise. You can imagine the ovaries as well as the testes. These are the factories for the sperm and eggs. They are internal, crucial part of your human body. So if you have kidney problems, you have liver problems, okay, then the function will not be good. So this is related to your blood supply. Okay, if you have diabetes, high cholesterol, you're not taking care of your health, the ovaries will also deteriorate, the testes will also deteriorate, and thereby your ovaries, the eggs and sperms also will be affected.
Okay. I hope that helps answer the follow-up question from Mr. Lukesh. Yeah. And are there anything specifically that you recommend to your patients that do this? This will help. What are those specific advices that you can give someone who are preparing for such a therapy?
Meaning for egg freezing and sperm freezing?
Correct.
Okay. Right. So if you are interested in doing this, of course, number one is maintain a healthy lifestyle. That's the most important. Okay, we don't look at magic cures. There's no magic potion or magical pills or magical supplements that will instantly get you a baby. Okay, so always have to start from the basics. Okay, live a healthy lifestyle. Okay, sleep well. Okay, try to reduce the stresses in your life. Okay, if you're talking about supplements, there's no magic supplements as well. You can take things like omega, fish oil, vitamin C, but those are also not magical. So if your body you have enough supplements from a natural diet, okay, you have a well-rounded diet, you have some vegetables, proteins, you should be getting enough nutrition for your body.
Right. And ladies and gentlemen, for those of you who may not have heard of cryopreservation before, or now that you already know what it is, there is a QR code on your screen that you may scan and find out more about this package, which is available on Doctor on Call, and of course, provided by Dr. Chong Koren here as part of the Thompson Medical Center Fertility services. All right, as Dr. Chong mentioned, there are a number of outlets across Malaysia, Puchong, of course in Kota Damansara, Ipoh, Kepong,
Penang, Ipoh, and down south in JB as
So
well.
multiple sites. Do visit Doctor on Call to find out more about these locations. Yeah, and we're still open for questions. If anybody have any more questions, please do type them out in the chat box. All right, and perhaps Dr. Chong, maybe I could ask you like this cryopreservation, right? As we are younger and getting into the whole family, getting married and things like that, rarely do we actually think about our future health. We're always so stuck into the whole cycle of life, and then you hit a certain age, and then you come to a sort of realization. I'm in a midlife crisis. I'm no longer growing this way. I'm already coming that way, right? So how would you convince, or what are the key factors you would advise a patient, right? To say, you know what, get this done early, right? Why is it so important that you get it done early versus later, and like don't wait and things like that? How would you explain this to your patients?
Okay, important thing is number one is awareness. Okay, a lot of us, they do not know that the biological clock is ticking. Of course, you hear about people nagging, getting pregnant earlier would be better. Okay, not at the later point. So we would advise, number one, of course, is awareness. Okay, the technology exists. Previously, it wasn't very stable, but now, of course, it's getting more and more stable, and the success rates are also pretty good. Yeah? So the problem we see is Malaysians in general, we're still a conservative, very shy bunch. Okay, so whenever we're talking about getting pregnant, we try to keep quiet. I've seen couples, when they come and try to get pregnant because they came a bit late, okay, their age is a bit higher. Some of them actually avoid meeting up with family members. During celebrations, they purposely do not attend because they don't want to get questioned about, why are you not getting pregnant? When's your baby coming? Yeah? So the number one thing is awareness. Okay? So the importance of age, negative effect on the ability to conceive or have a child. I always blame the several Hollywood stars. Okay? Sometimes you see them 43 years old, 45 years old, getting twins. So they say they've done IVF, and it looks very easy. Okay? But in general, there's only so much we can do, especially if the egg quality is not good or the sperm quality is not very good. So the earlier, the better.
Okay, so in general, once again, just I think one of the key take-home messages is if you were keen to preserve, the likelihood of your eggs or sperm being able to produce a child in future, the key take-home message is get it done early, all right, so that we have the most healthiest part of your life. I suppose if you take somebody's life and you were to take, taking a tissue sample or something would be a snapshot of that person's health at that time. So I guess you would also advise patients, before cryopreservation procedure to actually, if they were doing any smoking or drinking, to stop those, for a period of a couple of months first. Are there any medications that you also would give patients to prepare for a good sampling?
Before, let's say we want to freeze the sperms for the male. Okay, so we of course take a history, make sure they are fit and healthy. We also want to take a sample of the sperms first. Okay, if the sperms are not that great, we are actually advised to give them supplements for 2 or 3 months, live a healthier lifestyle, and repeat the process, 2 months later.
Okay, and let's see. We have a question from Azifa. So Azifa, hi. How much is the average cost? Azifa, please go ahead and just tolong scan kat QR code tu. All right. As soon as you scan the QR code, it will lead you to our Doctor on Call page, and all the details and information are there. Yeah. Okay. And the next one, this is from Sally. Are we able to choose the gender?
Okay. Choose the gender is it's IVF. It's part of IVF, not the egg freezing. Okay. Now we are able to choose the gender. Okay, but it's a bit complicated. It's not a straightforward IVF. Okay, the IVF we mentioned about 2 weeks of injections. We get the eggs out, and we observe the embryos to day 5. Now we are able to take a sample from the embryo before we put back inside the womb. Okay, so we do a DNA testing on the fetus, the embryos. So let's say we have 4 healthy embryos. we take a cell sample from each, then we do a DNA test. The original purpose of the test is to make sure the baby is not having Down syndrome or any chromosome problems. The side benefit is we will know whether it's a healthy male or a healthy female.
Understood.
So let's say we have 4, we test, 1 abnormal, 3 healthy ones. It could be 2 male, 1 female. It could be 3 females and 0 males. So whichever we are left, then we can put it.
Right. So it's not really a choice that a patient would say, hey, I want a male or female baby, but it's more of, we've got a number of embryos, okay, that are already in the natural process, as intended. Then we would select the ones that are, sexually determinant for male or female, and use that as the seed that we plant. Yeah. Now I've got a question about the embryo itself.
Yes.
So we all know that the embryo is actually the fusion of 1 sperm cell and 1 oocyte.
Correct.
Right, which is the egg from the female, right? So at this stage, it's just 2 cells.
Correct.
And for us to then be able to take another cell for DNA analysis, we can't possibly take one of these 2 cells, right? We need to let it grow further. And the way the human body replicates in this is really beautiful. It's literally like from 2 cells to 4 cells to 16 cells, and it's a square root number.
Correct.
Okay. So at which stage do we actually is it safe, or in which stage can we actually determine these genetic variances?
Now, we used to take it from the day 3 embryo, where there are 8 cells. Still, we take 1 or 2. Now we do the sampling at day 5. So day 5, there are 60 over cells.
Right.
Okay, so we make sure we take them from the placenta, the cells which will go in the placenta, and not from the baby itself. So we won't injure the baby. We take them from the placenta. I'll just move the slides backward. What tissue? Okay, so this one is the embryos. Okay, you can see on the gray color one, this is a day 3 embryo. There are 8 cells there, 1, 2, 3, 4, 5, 6. Whereas on the other side, this is a day 5 embryo. So this lump here, this will be the future baby. The other 80% will be the future placenta. So we can take the sample from the placenta cells. So you will take about 2 or 3 out of 60 over cells. So
Right.
you make sure you don't damage the baby.
So the baby grows on one side,
Correct.
and there's a part that actually attaches to the uterus.
Yes.
We call the placenta.
Yeah.
Okay, and that's where I think a lot of the blood circulation, nutrition, and things come through to the baby. So it's coming from the same embryo, but we are taking the cell from a safer place, and it's not dangerous. Yeah?
No, it's not dangerous.
Okay, I guess the last question, Dr. Chong, is really about how safe is this?
Which one? The egg freezing?
How safe is egg freezing?
Okay.
And are there things that people should be worried about when they're doing cryopreservation?
Okay, the egg freezing process needs at least 10 days of injection. So the main problem will be getting over the fact that you need to inject yourself with a needle. Okay, the needles nowadays are very small. Okay, it's different from the one who needs to take blood. Okay, it's the same like those people with diabetes, they need insulin injections every day. So it's a very fine needle. And pain-wise, it's like an end bite. People use end bite a lot, but this is it's like an end bite. Yeah. Then as the eggs grow bigger, there of course will be a bit of swelling. And after egg collection, you feel sore for about 2 or 3 days. Okay, but once the menses come, the next, after 2 weeks, then you're almost back to normal already.
Okay, so Dr. Chong,
Yes.
Thank you for the time, explaining to us about cryopreservation, how is it different from IVF, right? So maybe we can conclude our session today. And maybe I would like to just wrap things up by saying that, ladies and gentlemen, if with our very different social structures, way of life today, extremely busy, people have careers, you may not have found Mr. Right. There is a way for us to actually preserve our future generation or life, okay, by this therapy such as cryopreservation, right? And the key message is that if you wanted to follow up with this type of therapies, it's best to do it as early as possible. Don't wait until you're past 35 or 40 to make a decision, because the chances are much less. And this is a very, very safe procedure that has been performed for more than 40 or 50 years. And instead of just consulting with Dr. Google, do Google up Doctor on Call and look for Dr. Chong, okay, for you to get more detailed explanations. And if you're interested, to also get one of these cryopreservation packages, which are offered by Thomson Medical Fertility Center here in Puchong and all the other branches, right? So all of these are available on doctoroncall.com.my. Please do scan the QR code, follow us on our Facebook page, and watch out for updates, ladies and gentlemen. I would like to end by thanking Dr. Chong for his time, in his effort to clarify all these doubts in the midst, and give some reassurance that yes, even as busy individuals looking to start families, there is a way for us to, and another option for us to consider things later in life.
Yes.
And also, finally, to the audience, thank you very much for tuning in today. And if anybody, your friends, family, acquaintances that you know who need such advice, please do share this Facebook link with them. All right. Thank you very much, everyone. Have a good day. See you at the next Q&A with the specialist.